You're watching KARK4 News at 4.
As the Delta variant continues to surge in the natural state, there are still many questions concerning COVID and the vaccine. We asked you on KARK's Facebook page to submit your COVID questions. There is a post there at the top of the page. You can still ask questions because we are so thankful. We have Dr. Wendell Pahls with Baptist Health who is joining us live to answer many of your questions. Dr. Pahls, thank you for joining us today.
Thank you for having me.
Well, let's start with a question coming in from Rosa. Rosa asks, I'm taking chemo pills. Is it safe for me to get the vaccine?
Absolutely. We would encourage you to go ahead and get vaccinated, even if you're relatively immunocompromised on something like chemo or steroids, or if you have bad diabetes. The reality is sometimes you don't get quite the immune response in those situations that we would like, but nonetheless, it's perfectly safe, and we would strongly encourage you to do it.
And this question now coming from Karen. Karen asks, if someone has had COVID, are they immune from the virus for any length of time?
Early on, there was a belief that you were relatively immune for roughly 3 months. That was with the original. The Delta may be a little bit different. I think the standard statement is still you're probably immune for roughly 3 months. But we're not totally sure that's true with the Delta variant at this point.
Still so much to learn as we discover more about COVID. This next question coming in from Shayla Brammer. Shayla says, why is it safe for pregnant women to receive the vaccine, pregnant women who are carrying a baby, but the earliest age to receive the vaccine is 12?
What a great question. The reality is that the mothers do confer some level of immunity over to the fetus. So we strongly encourage pregnant women to get vaccinated. Tragically, we had within the Baptist system the loss of a pregnant 20-year-old mother to COVID. Just a terrible tragedy. So even though you're pregnant, we would strongly encourage you to get vaccinated. Realistically, at some point, there will probably be a pediatric immunization for COVID as well. The studies aren't there. They don't have the data. That it's just not ready yet. But realistically, sometime in the future, there will probably be a pediatric immunization for COVID as well.
And that's a lot of the questions we have received on our Facebook page have been about vaccinations. This question coming in from Fran. Fran asks, will the FDA approve the Moderna vaccine as well?
I'm sure they will. It takes roughly 6 months of data gathering after the emergency use authorization is approved for the vaccine manufacturers to gather data. And then it takes them a month or two to put that data together and present it and get the FDA to approve it. So it's a 6 to 8 month process or something like that. Roughly, probably in October, as a rough estimate, we would expect that Moderna would be approved. Obviously, I don't have any insight into the FDA, but I think most people expect it sometime in late September or October.
That's certainly some good news. Dr. Wendell Pahls from Baptist Health, thank you so much for taking time. I know you're a very busy man, so we appreciate you and everyone at Baptist Health.
Honored to help anytime.
Thank you again. And he has been so kind to join us throughout the week. He will be answering your questions. If you have any question about COVID or the vaccine, please go to our Facebook page, KARK4 News. And again, it's at the very top of the page. You can ask your question, and he may be answering it here tomorrow on the air.